You want to get rock hard? Welcome, gentlemen. It's Anita Tatavarthi. I'm a licensed acupuncturist with over 20 years of experience. I've also treated over 100,000 patients in my lifetime. Today, I want to share with you a technique that can help you. A gentleman came in. He was 71 years old, and he said to me in the intake, I want to get rock hard again. I thought to myself, well, let's see what we can do. I asked him, had he been checked out by his medical doctor? He was. There's nothing serious. His blood pressure was slightly elevated, which is not uncommon. I said, please continue to work with your medical doctor on your blood pressure. I also asked him what his situation was. He said, well, he's been watching porn and masturbating from watching porn. I said, could you cut down on the amount of masturbation and watching porn? He said, I want to be rock hard more than watching porn. I said to him, all right, I know you're watching porn daily and you're masturbating either daily or every other day. Let's try to cut it down to a couple times a week and then a couple times a month. And he said, all right. He had an upcoming vacation, and he said during that time, he'll be out of his routine to stop with watching porn and masturbating. I said, when you come back from vacation, please let's try to reduce the amount of masturbation from watching porn down to a few times a month. He agreed to do that. We did acupuncture. If you are seeing an acupuncturist in town, I want you to consider having him or her do, of course, 4 gates. You can also do PC 3, 6, and 8, triple warmer 3, 10, spleen 6, 7, 9, liver 3, 8, stomach 43, 41, as well as gallbladder 34 and 41. This will be a very comprehensive treatment to help his doctor help the patient with blood pressure, as well as creating a beautiful circuit where blood flows through to the genitalia. Also, there are calming points that can help relax the patient so he has less tendency to watch porn to masturbate. We did the acupressure, and the acupressure that we did for this gentleman was very comprehensive. We went on the yin side of the forearm, and then we went on the yang side of the forearm. Then we acupressed the palm of the hand on both sides, as well as acupressing the posterior aspects of both hands. And then we asked to acupress each finger. So going through reflexology as key mirror images through the acupressure bring blood flow to different parts of the body. This whole area represents the lower abdomen, as well as the wrist represents the P-spot or the prostate. We start off by doing this so that it pushes blood flow to the root of the genitalia, and each of the fingers represent the eggplant, penis, or genitalia. We want to do this bilaterally so that you have a full circuit in your body. We're going to do this for 2 minutes, and of course, we're going to nasal breathe as it also circulates blood flow to the genitalia. Breathe in from your abdomen or chest, close your mouth, and breathe from one or both nostrils. The rate is up to you. If you do rapid nasal breathing, be sure to do it seated down or laying down. Let me tell you what happened to this gentleman. We did a couple of months of acupuncture, and he was very diligent in doing the acupressure morning, afternoon, and evening. He didn't mix and match with the protocols. He chose the protocol that I'm about to share with you. And he kept his promise. When he came back from vacation, he did not watch porn or he did not masturbate. In fact, he did not do that all but maybe once a month. And he and his partner were enjoying sex that had hardness and duration to his satisfaction. May not have been what he was used to in his teenage years and in his 20s, but he said that he got to about 82 to 85% of the way there, which was very satisfying for him. And I was happy that he was happy. And so keep this tip in mind. Key things that this patient did the acupuncture for a couple of months. He also did the acupressure, this protocol, 3 times a day. He curtailed watching porn, which he used to masturbate, down to a couple times a month. And he was able to get the hardness and firmness that he desired. I love hearing from you, and I love reading the comments. I personally respond back. Let me know what your situation and story is, and I'll do my best to post a video for you. All right, let's follow along with me for the next 2 minutes. Here we go. If this is something you want to experience, do get checked out by your medical doctor. Consider doing this protocol 3 times a day. You can mix and match with some of our protocols, but do this specifically at least once a day, but doing a protocol morning, afternoon, and evening. If you want a virtual appointment with me, I'm a licensed acupuncturist. You can get one up on top. I believe it's the second link in the link tree. And also we have a women's channel. So if you have a lady friend in your life, do send her on over to our women's channel and also TikTok and Instagram, as there's great women's health there. Whether you're having a virtual appointment with me or you are watching us on TikTok, Instagram, or YouTube, all the monetization money is going towards 2 free clinics. One in my hometown of Washington, D.C., and a second near my hometown of Hyderabad, India, as I was raised between 2 countries. We're currently fundraising. If you want to give a donation, it is in the first link down below and the first link up on above. Thank you so much for your support. I wish you all the best in having that satisfaction in your life. Until next time, have a great evening, and we'll see you here tomorrow from your friend and acupuncturist, Anita Tatavarthi.
We would like to thank Anita's friends and business contacts who donated their time, money, and medical supplies to the Rapely Free Clinic.
We're here in my grandfather's marriage hall, which is now being converted into our clinic or free hospital. We have been here for 4 months, and we have treated about 1,000 patients with over 8,000 or 9,000 patient visits. Most of the patients are farmers and agricultural workers, so a lot of the things that they're dealing with is pains, lots of different